Bismillahirrahmanirrahim. Dear students, now we are going to study the effect of environmental agents on the genetic brought up of a human being. And The environmental agents influence the developing baby, causing their disorders in the baby and certain defects in different organ development, and this is known as teratogenesis. And There is the certain time period during which the environmental agents act. This time period is known as period of vulnerability, and the period of vulnerability is the period of organogenesis, that is the period of development of the organs, which starts from the day 15 or the start of third week of pregnancy to the day 60 or the end of eighth week of pregnancy. This is the time period when the environmental influence may interfere with the organ development and result in different derangements. And Here in the diagram, you can see that by prenatal death, we mean that if any external environmental agent will come and cause damage, there will be miscarriage. This is before 2 weeks. And After the end of second week or the start of 15th day or start of third week till the end of eighth week, as you can see over here, there is development of different organs, external and internal organs of the baby, which starts from central nervous system, and then development of heart and cardiovascular system, and development of extremities, eyes, and then the external genitalia. During this phase, if any environmental stimulus will come, it will cause a defect or interfere with the development of either CNS or the development of heart or extremities or eyes, or interfere with the development of external genitalia. So, the environmental agents which interfere with the development of organs of the fetus, they are known as the teratogenic agents. And This is an environmental agent that produces abnormalities during embryonic or fetal development. The maternal disease or altered metabolic state can also affect the environment of the embryo or the fetus. For example, if in case of maternal disease of any infection like rubella, or in case of altered metabolic state, there is an example of maternal alcoholism. They both interfere with the development of baby. And The teratogenic agent act why one of these three mechanisms, either by direct exposure of the pregnant female and the baby to the agent, for example, in case of radiations, or through exposure of soon to be pregnant woman with an agent that has slow clearance rate, that a teratogenic dose is retained during early pregnancy. For example, certain chemotherapeutic agents, cancer chemotherapies, and certain other chemical agents, or as a result of mutagenic effect of an environmental agent that occur before pregnancy, causing permanent damage to a woman's or a man's reproductive cells. This includes certain other agents which can be chemical or radiation or drugs. Here, in case of soon to be pregnant female, certain infections also come in play. So, we divide them or classify the teratogenic agents into three types: radiations, number two, drugs and chemicals, and number three is the infectious agents. In drugs and chemicals come the alcohol, and then anticoagulants, warfarin, then anticonvulsants or anti-epileptic drugs, chemotherapeutic drugs like minopterin, methotrexate, 6-mercaptopurine, and then vitamin A derivatives, isotretinoin, Accutane, which is used by skin specialists for the treatment of acne and certain other skin conditions, and then propylthiouracil, tetracycline, which is an antibiotic, and thalidomide. In infectious agents, there come the viruses and non-viruses, that is bacterial and other infections. In viruses come cytomegalovirus, herpes, measles, rubella, mumps, and varicella zoster. Non-viral infections include syphilis and toxoplasmosis. In the infectious agents, basically you need to remember torch infections. For torch, T for toxoplasmosis, O for other infections like syphilis, etc., and R for rubella, C for cytomegalovirus, H for herpes simplex. So, to summarize, teratogenic agents include radiations, chemicals, and drugs and infectious agents. And period of vulnerability is the period during which the embryo is most susceptible to teratogenic agents during the rapid differentiation and development of body organs and tissues from day 15 to day 60 of conception. I will end the lecture with a note that invisible threads are the strongest ties. So please keep communicating with each other through virtual means instead of going close together, and keep your social distancing. May Allah keep you all safe. Thank you so much.